A lot of people think of fibroids as a one and done kind of thing. We'll take out our fibroids and everything is fine. But in fact, they come back in 60 to 70% of younger women especially. They can make you look pregnant. They can cause anemia, fatigue. They don't let you live your best life. And so often they delay care and treatment.
So first of all, thank you to Dr. Shirazi and sharing knowledge as per usual. I have a question for you. Riddle me this. What is the worst nation on this planet? Any answers? Procrastination. Procrastination is something that you can delay different things in your life here and there and may not have a consequence. When it comes to something like your health, or particularly something that is compromising your health every second, every minute, every hour of the day, like fibroids, you probably want to think twice about what you do about it and when you do something about it. What Dr. Shirazian is mentioning is something that many women do. They not only suffer in silence, but they delay treatment. And so here's one of the reasons why women delay treatment. Why? Because they have this sort of toss-up. Am I going to suffer, or am I going to do this invasive surgery because it's the only thing that I'm being offered? I'm being offered to do a myomectomy, something that's going to pluck out my fibroids and get some of them, the major ones, but it doesn't always get all of them. Many times, fibroids are left behind, which amounts to this 60 to 70% of women, many oftentimes, who have fibroids that recur. But these aren't fibroids that necessarily grew again. These were fibroids that were there all along, but the surgeon was not able to get to them safely in order to restore the structural integrity of the uterus of a woman who wants to be able to get pregnant. So what happens in many of these cases is you have a woman who says, I don't want to do something that's going to be an invasive surgery. So what am I going to do? I'm just going to suffer because the devil I know is better than the devil I don't know. Let me give you a different paradigm. And I want you to consider this. What if there's a treatment where it wasn't an invasive surgery? What if there was a treatment that allowed you to have a little 2mm incision in your groin that required a Band-Aid to be placed on it for about a week? What if that incision, which is 2mm, disappeared in 3 days? What if you were back to work in 7 days? What if all of your fibroids were treated from their very roots and not just some fibroids? What if your fertility and your uterus was restored in the process? And it's called the uterine fibroid embolization, UFE. You may not have heard about it. Why? Because it's a treatment exclusively offered by board-certified, fellowship-trained interventional radiologists. It's not something that you can just talk to a doctor, a generalist, or even a specialist who specializes in some other work about it, because they don't know about this particular procedure, even though they may have heard about it. It's a procedure that offers, again, complete treatment, minimally invasively, and no general anesthesia. So again, what's the worst nation? Procrastination. Question for you: will you choose to suffer in silence and delay treatment? Or will you choose something that will help you here and now? If you didn't know before, now you know. I'm Dr. Mikhail Higgins, fibroid specialist and interventional radiologist. I cannot wait to start the conversation that gets you on your path to true freedom from fibroids. Talk soon.